It's not the first time Donald Trump has pulled the United States out of a global body, but the World Health Organization, in the midst of the worst planetary pandemic in decades. Hello, everyone. I'm François Picard. Welcome to another confined edition of the France 24 debate. Yeah, the US president under fire at home for his handling of the COVID-19 outbreak, pulling out of the WHO, blaming its leadership for being too beholden to China. We'll talk about the timing and the charge leveled by Trump. Should Ethiopia's Tedros Adhanom have called out Beijing much earlier? And could China have nipped this in the bud? Either way, well, that's hindsight now. The question going forward is how the WHO makes up the shortfall from its biggest donor, and what impact on developing nations that rely on the UN body for public health policy. Just as many are asking if this crisis could be an opportunity to rethink healthcare in the US, here in France, and also at the global level. Today in the France 24 debate, we're looking at Donald Trump taking on the WHO, and joining us, he's a former director of maternal, child, and adolescent health at that UN body, Dr. Anthony Costello, who teaches at University College London. Thank you for joining us from Yorkshire in Northern England.
A pleasure.
We also want to welcome to the show, he writes on global health politics, most notably in World Politics Review. Jeremy Yond is a professor at the University of Minnesota at Duluth. Welcome to the show.
Thank you so much for the invitation.
His morning editorial on international affairs can be heard on French public broadcaster France Inter. Journalist Pierre Haski, former Beijing correspondent for Libération. Thank you for being with us.
Hello, François.
The France 24 debate, where you can join the conversation on Facebook and on Twitter, the hashtag F24debate. Yeah, it's all about the timing. Just as Donald Trump is getting into quite a heated row with state governors in the U.S. over how to harmonize the handling of the COVID-19 outbreak, comes the announcement from the White House on Tuesday. Haxi Myers-Belkin has more.
As the U.S. COVID-19 death toll continues to climb, President Donald Trump has halted funding to the organization charged with leading the global response, but not before laying out his accusations.
Had the WHO done its job to get medical experts into China to objectively assess the situation on the ground and to call out China's lack of transparency, the outbreak could have been contained at its source with very little death. This would have saved thousands of lives and avoided worldwide economic damage. Instead, the WHO willingly took China's assurances to face value, and they took it just at face value.
Key to Trump's grievances, his claim that the WHO opposed his decision to ban non-US citizens arriving in the US from China from February the 2nd. However, even after the organization declared a global health emergency on the 30th of January, Trump himself was downplaying the threat, continuing to hold rallies and even referring to COVID-19 as a new hoax by his political rivals. Trump's move has drawn disbelief and alarm around the world. The UN Secretary-General Antonio Guterres, for one, insisting that now was the time for the international community to work together to stop the virus, and not a time for funding cuts. Last year, the WHO received $400 million from the US, by far the organization's largest donor. Trump's move will come as a hammer blow as the world continues to battle its most challenging health crisis in recent memory.
Anthony Costello, your reaction to the decision?
Well, I think it's a political distraction, to be honest. I think he's facing domestic criticism at home. And I believe yesterday President Obama endorsed Joe Biden. And maybe he wanted to find some smokescreen or a useful scapegoat. And the World Health Organization is also always a useful scapegoat for politicians. I think we do need to look at the facts so that people are clear. China first reported this outbreak on the 31st of December. The next day, WHO set up an incident management team. 3 days later, they reported it on social media and in technical journals. And on the 10th of January, following expert advice, not just from China, they put out technical guidance for all countries and said that there was no or limited evidence of human-to-human transmission here. That changed about 3 days later because at that time, and indeed the UK expert committee looked at it and agreed with the assessment of limited transmission, but then there was a case reported in Thailand, and also 15 healthcare workers in China were infected. So the very next press conference, Maria Van Kerkhove from WHO reported that and said there is now evidence of a limited transmission and we need to follow it up carefully. They then wanted to get into Wuhan. They were only allowed in a week later, the country representatives from WHO. And at that time, they said it's absolutely clear evidence of widespread community transmission and that there was a high mortality rate in the hospitals. So just two other things. Tedros then went to China to talk to the president and asked for an international review group to come into the country. And that was only allowed in on February the 16th, so nearly 2 months after this whole business had started. So those are the facts, and I don't think Trump is really addressing those.
So the foot dragging from what you're suggesting came not from the World Health Organization, but from the Chinese themselves at the outset. And yet we heard the head of the WHO, Dr. Tedros, speaking. Let's listen to that soundbite of him speaking at the end of January.
The Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak, despite the severe social and economic impact those measures are having on the Chinese people. We would have seen many more cases outside China by now, and probably does, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world.
Extraordinary efforts on the part of China, said Dr. Tedros. Again, this is the end of January, before that February 16th date, Dr. Costello, where you said that Beijing led in the WHO independent team.
Yeah, look, certainly you can criticize Tedros for more than effusive language towards the Chinese. We have to separate. China scientists did well in December to identify this virus and sequence it. When President Xi Jinping took over the control of this, probably on January the 7th, he'd already been warned that this was a serious outbreak by his own pandemic experts, and yet didn't really do anything until about the 21st, 22nd of January. And it was that delay that led to a lot of criticism, both in China and obviously outside. And then after that period, when they really realized they were sitting on a disaster in Wuhan, the response of the Chinese in terms of locking down Wuhan and putting partial lockdowns around the cities that it had spread to was actually a fairly impressive operation. And the report that came out later in February from Bruce Aylward, pointed out the good things that they had done. So there were very definitely good phases and bad phases. Yes, I mean, the problem is when you're working for the World Health Organization, it's a member state organization, and any director general will be very diplomatic with its member states. And they always speak in UN code, and they try not to offend people. And WHO was in a difficult position because they knew that something was going on. They knew that they weren't getting access and getting the information that they wanted. And if you go out and criticize, the chances are you'll just be kept out. The other option is to be diplomatic. And Tedros, by his nature, tends to be very warm and supportive of all member states. For example, just one example, in the UK, when we, on March the 12th, decided to stop all containment measures, when we actually only had about 10 deaths, the WHO, I know for a fact, were pretty horrified by this. but they simply put out another statement saying, when you decide to move to a delay phase, you don't stop containment. You must find the virus. You must contact trace. You must test. And so they emphasized that very specifically, but they didn't call out the UK. And indeed, in March, he also was very giving a lot of praise to President Trump, even though President Trump has made very serious delays in the US response. So this is WHO having to kind of walk a diplomatic tightrope.
How about you, Pieratsky? Do you give Dr. Tedros the benefit of the doubt?
No, I think frankly, we need to distinguish between the facts and the timing of Trump's decision. On the fact, there's a lot to be said, but the timing is very bad. And I agree with the comment of Secretary General Guterres that this is not the moment to undermine the work of the WHO right in the middle of the pandemic. These are things that should be left for after, when everybody, national governments or international bodies, will be under scrutiny to know what went wrong and if only to improve things for the future. But let me remind you of one example in which I was a witness, is the SARS epidemic in 2003 in Beijing. The Chinese government at that time was hiding the fact that there were cases in the capital, in Beijing itself. And at one stage, there were so many rumors and worrying signs that the WHO Beijing office held a press conference. There were all the TV networks from around the world. And the head of the WHO China said, we don't trust the government figures anymore. And this was a turning point in the fight against SARS, because 2 days later, the Minister of Health and the mayor of Beijing were sacked, and the government took radical measures to fight SARS. So I think there comes a moment when an organization like WHO should not please a member state or a government when it deals with a major crisis like an epidemic or future pandemic. So I think there is including in what Dr. Costello said, there is a problem maybe of personality, or a problem of style, or maybe China has gone too big to be told the same thing as in 2003. But the fact is that in 2003, WHO played a key role in changing the Chinese government attitude.
Of course, China didn't have as much clout back then.
Exactly. I think obviously today it's much more difficult to say bluntly to China anything. And secondly, I think Donald Trump has only to blame himself for his lack of influence in the UN bodies, because it's true that the US is the first contributor to the WHO budget, or to the UN budget for that matter, but has completely divested its political clout or its energy into every single UN organization. And therefore, we cannot blame others for using the vacuum and to exert influence in those organizations. But I think the timing is definitely the wrong moment, and it has to deal with domestic politics, and there I agree completely.
Yeah, the timing may be the wrong moment, but there are politics inside of the World Health Organization. Some 3 weeks ago, the Assistant Director General of the WHO, he's a Canadian, he's called Bruce Aylward, was speaking to Yvonne Tong. She's a journalist for Radio Television Hong Kong, when she asked him a question about Taiwan.
Will the WHO consider Taiwan's membership? Hello?
I'm sorry, I can't hear you. I couldn't hear your question.
Okay, yeah. Let me repeat the question.
No, that's okay. Let's move to another one then.
Right, because I'm actually curious on talking about Taiwan as well, on Taiwan's case.
The World Health Organization putting out a statement a couple of days later. I'll read it to you. It says the question of Taiwanese membership in WHO is up to WHO member states, not WHO staff. However, WHO is working closely with all health authorities who are facing the current coronavirus pandemic, including Taiwanese health experts. Certainly, Jeremy Yond, from a public relations standpoint, a bit of an own goal there by the World Health Organization.
Yeah, but it also speaks to the larger geopolitical context in which an organization like the World Health Organization has to operate. It's got, as you know, both of our commenters have already noted, it's trying to walk these tightropes of trying to figure out how do we try to get as many states involved in this process as possible so that we can get as much information, be as complete as possible, but at the same time to try to recognize that there are these broader political and economic contexts in which it's trying to operate. And so the question about Taiwan and its role within the WHO has been something that has been an ongoing debate, even down to whether or not Taiwan is able to participate in the World Health Assembly and under what circumstances, under what names it's able to do that. So this is part of a broader issue that the World Health Organization is facing, especially in its relationship to the People's Republic of China and how that affects the relationship with Taiwan.
So what's your religion when it comes to Dr. Tedros? He was Ethiopia's candidate to run the World Health Organization after Margaret Chan. Ethiopia, which has close ties with Beijing. Your thoughts on that, Jeremy?
Sure. I wouldn't say that he was necessarily China's candidate by any stretch of the imagination. He is someone who comes in with a skill set that I think actually serves the Director General well. He is someone who both has the technical qualifications in health and medicine, but then also was the foreign minister of Ethiopia. And so understands that sort of political diplomacy and the role of health within diplomacy. And we do know that Tedros was not the candidate that was preferred by the United States. But as the first Director General for the World Health Organization coming out of Sub-Saharan Africa, he inspired a lot of confidence and a lot of support among those states in particular, and is someone who I think it was seen as someone who could help bring in the perspectives of the Global South and those priorities into the World Health Organization.
Dr. Costello, I was looking through Twitter, and there was a researcher at Oxford, Max Roser, who tweeted a photo of an article, a screenshot of an article from the New York Times, which listed 5 go-to websites for data on the COVID-19 outbreak. It included places like Johns Hopkins University in Maryland, but it didn't include the World Health Organization itself. Your reaction?
Yeah, I think there are data issues at WHO. I mean, I support the organization. I wish it was better funded, and we could come on to that if we have time. On the data issues, I would agree that there's been a big transformation in the last 2 years. When I was there, I worked with somebody called Tees Burma, who had been there a long time, was a very competent data statistician, manager, and was very close to the previous Director General. He retired. They've had a lot of reorganization of their data systems, and they've linked up very closely with the Institute for Health Metrics and Evaluation, which is a very large group in the University of Washington, Seattle, which gets huge funding from the Gates Foundation. And that's run by Chris Murray, who's an excellent data person. But of course, it has been a criticism that, having a single university in America funded by Bill Gates advising the WHO at a time when it's being transformed, it is unsatisfactory. And I think there does need to be a close look at how that can be greatly strengthened. But a lot of that does come back to the funding issue, and I could talk a bit more about that.
Yeah, because that $400 million that won't be coming from the United States anymore, where is it going to come from?
Well, in the short term, you see, I'm not sure it will happen. I think, the way President Trump works is at any one time he'll lash out at someone. And, he was pouring praise onto President Xi Jinping in January. And now, of course, it's, China's the bad guy. So I'm not actually sure this will pass muster. They'll have some review. WHO will reorganize its finances. I imagine other states will step up. The philanthropists will come in. In the longer term, if they did decide to cut funding, and they're the biggest state funder, it would have a very serious effect. It would weaken WHO even more than now. But just on the funding, I mean, the annual budget of the entire World Health Organization is the same as my university in London.
Wow. Jeremy Yude, your reaction to that?
Yeah, and you know, the sad thing is that every year that President Trump has been in office, he has tried to cut funding for global health programs writ large, and it's been Congress that has stepped in every time to actually backfill those fundings and make sure that that money is still coming forward. So this is something that has been part of a trend for what President Trump has done. But in these last 12, 18 hours since President Trump made this announcement, a lot of people have been trying to figure out, well, what would this actually look like? What sorts of powers would President Trump have to do this? Where would this funding come from, and at what time would this happen? So I have to agree with Professor Costello. We actually don't know how much of this is a fit of pique coming from President Trump, or how much of this has actually been planned out, and there's some sort of strategy moving forward for it. And so there is a lot of uncertainty around what this would mean and what the actual mechanisms would be. But if your concern is that your country doesn't have enough influence within the World Health Organization, that other countries are playing too big of a role, by completely stepping out of that organization, by withdrawing your funding, you just lose any influence and power to help shape that organization. If you withdraw your leadership from that creates a vacuum, and other countries are going to go do this. So actually, this is very much an own goal by the United States if it decides to go through with this in terms of its own influence within the World Health Organization.
So, Pierre Aski, who is going to fill that vacuum if Donald Trump goes through with it?
There were some suggestions that Europe could fill the gap. Not that Europe is full of money at the moment, but certainly it has the political will to keep the WHO running, and could be ways for Europe to step in. But I think whatever happens, it will be decided after the crisis. And after the crisis, there will have a reconsideration of everything that surrounds the WHO, whether it's funding, but also obviously the way it behaved and it performed during this crisis. So I expect many things could happen, including a change of mind in the US, depending on the outcome of the presidential election, of course, and also depending on the review of the behavior of the WHO during this pandemic.
But there was criticism, Pierre, of the WHO when there was the H1N1 outbreak. There was criticism during the Ebola outbreak. We didn't see a great review after either of those incidents, did we?
That's true, but nothing that's obviously reached the proportion that we see today, whether it is the crisis itself or the level of criticism. I don't remember having ever seen an American president make such an issue with the WHO in the past. But there is another precedent, which is the way the US pulled out of UNESCO. UNESCO is Paris-based. It deals with education and science. And the US did actually cut its funding and withdraw from the organization, which is already still in existence, but shadow of itself. So you should not underestimate the capacity that the US has to undercut a body like the WHO.
Can I just say, chip in about this funding? The Americans really control UNICEF. There's only ever been an American director of UNICEF, which has 3 times the budget of WHO. It controls the Global Fund effectively. It controls the World Bank and many of the funding bodies around. It doesn't have control over the WHO because it's a democratic organization, so it's part political, part technical. And since Reagan's administration, they froze the rise in assessed contributions. So states over the years have seen in real terms all their contributions to WHO fall. And so WHO has to get the begging bowl out for any kind of crisis. And in February the 4th, Tedros put out a call for $675 million to support this global response to COVID. And I met him on March the 4th, exactly a month later. And I said to him, Tedros, how are things going with the call for the 675? He said, do you know how much I've received? And I said, no. He said $1.25 million. I mean, that is a small single lab research grant. That's the scale of neglect. Now, I don't blame the Americans just for this. I think member states have completely failed to defend and fund what should be a world public health body to protect all of us. And the lack of response from any businesses, from private sector. It's pretty much Bill Gates alone who tries to prop up the World Health Organization. And that raises issues in itself about influence and the rest. But this is the scale of underfunding and the fact that some bodies, some political leaders simply don't like the fact that many member states have an equal vote to their financial power and political power. So that is a major problem for the World Health Organization in future.
All right, so two questions for Jeremy Yude. First of all, does it bother you that the Gates Foundation, because I know they've even been talking about perhaps the Gates Foundation filling the shortfall if ever the United States does go through with its complete pullout from the WHO? And secondly, how do you build a better World Health Organization?
Well, to the first question about the role of the Gates Foundation within the World Health Organization, the Gates Foundation itself has came out a few years ago and said, look, you can't look to us to fill the gaps that governments are leaving if they're not funding global health organizations. So they can provide some resources, and they have been a very generous contributor to the global health governance writ large, including the World Health Organization. But there are limits to what the Gates Foundation can do. Plus, then there are questions about what sort of legitimacy and authority a private organization like that has for helping to play such a determinative role in the global health agenda. So it could help to fill in the gaps, but it's not going to be something that is going to completely make up for what the US is contributing. In terms of building a multilateral and a multinational global health organization, the World Health Organization has been around since 1948, and it has this constitutional mandate to be this international coordinating body, and has done some incredible work in this time period. But we're looking at an organization that was crafted in the immediate aftermath of World War II, and there are legitimate questions about whether or not the structure of the World Health Organization as currently exists is the right sort of structure that can address the sorts of challenges and questions that are facing the world.
Getting to the essential one that we mentioned earlier with Dr. Costello, I mean, if there was one job the WHO should be doing right now, that is harmonizing all of the data from around the world so that scientists can all sing from the same hymn sheet. That's not happening, though, is it?
Right, and that goes back to some of these issues around funding. And so much of the organization's budget is actually constrained by the donors. They say, we will give you X number of dollars for this specific project. And so the World Health Organization doesn't really have the sort of flexibility it needs to say, this is something that we want to prioritize. We want to prioritize data collection and dissemination and make sure that we have the world-class platform for doing that that's happening within the World Health Organization as opposed to at IHME or any other sort of organization. And that goes back to the power that the member states give to the World Health Organization to help determine its own agenda and figure out what its priorities are and where it can leverage its strengths.
Is it a question of money or is it a question of politics?
It's a question of both, and part of the politics gets into that. This is the way that states help to exercise influence over the World Health Organization. Is they hold the purse strings. They say we'll give you money, but we'll only give it for certain projects. So the World Health Organization lacks some power to help determine its own agenda, and the member states have the ability to tie their contributions to specific types of projects.
Pierre Aski, your thoughts?
I think we're all dreaming at the moment of the world after. It's a big word, and a lot of intellectuals and philosophers are thinking about that. And in an ideal world, the WHO would be independent from the influence of member states. I think we're dealing with a theme, health, public health, like the climate change crisis, where we need scientific work. We need to have people independent from the influence of states who can raise the alarm when there is a potential threat to public health around the world. And in the current crisis of multilateral organizations, especially with an anti-multilateralism president in Washington, we urgently need that. I don't think this will happen because no state will give up its right or its influence on the UN and on its member organizations. But I think that's where we should lead, and that's where public opinion should push to avoid the kind of controversies we're having now with the politicization of the work of such a crucial organization.
Jeremy Yude, I saw on the opinion pages of the New York Times this Wednesday a column penned by two professors who are both doctors at the University of Pennsylvania saying this is a wonderful opportunity for the U.S. to rethink its healthcare system. Do you share that optimism?
I think it's a moment that has really put a bright spotlight on the shortcomings within the U.S. healthcare system, and has shown the limits of employer-based healthcare systems, and just the fact that we lack a universal healthcare system here in the United States. Whether there's going to be the political momentum after the pandemic passes to actually make those sorts of significant changes is still up in the air. But it's really bringing to the forefront the fact that the current health system or health insurance system that we have in the United States is simply inadequate for trying to deal with a pandemic on this scale.
Anthony Costello, when Boris Johnson came out of hospital, he thanked he singled out two nurses, one from Portugal, the other from New Zealand. Is this crisis going to signal, a change, a wholesale change in politics?
I think it will around the world. If you look in Britain, I mean, the NHS has been relatively protected from austerity over the past 10 years. Public Health England has been savaged and moved from under the NHS to another section of government. And I think that was part of the problem in our response. I think the Tory government is going to face an enormous problem because on the one hand, they're, like every other government, becoming like the biggest socialist in history because they've got to bail out the entire economy. But then what's going to happen after that? I imagine they'll want to go back to a more austere environment. So we'll have to wait and see in the UK. Just on one final comment about the WHO, because you've raised, I think one of the problems with WHO is that it fulfills both a political democratic function and a scientific function. And as the budget has shrunk, successive director generals have tried to support one or the other. And I think Tedros is more politician than technical. And I think the scientific basis and strength of WHO has been severely weakened. Personally, I would like to see a much stronger, almost like a world CDC, made up of the best brains from around the world, maybe with figures with Nobel Prize winners and the like, having status there and fully independent to advise a political director general who is under democratic control. I think that's an opportunity, and it might be that if member states don't step up, that other philanthropists might come in and help develop that, because I think it is needed.
Pierre Aski, when we spoke earlier, that was your dream, wasn't it, to have a kind of a global center for disease control?
Yes, exactly. I think that's exactly what we need. We need to have bright and independent people looking at what needs to be done, and that's what doesn't exist at the moment, and what this crisis has revealed, or at least has exposed in a more open way than was known before. Maybe we can dream that this crisis will bring positive thinking afterwards, and that the world will be intelligent enough, smart enough to draw the lessons and make the necessary changes and adjustments to the way we are organized to prevent such a disaster in the future. I'm not very optimistic that this will be possible, because what we see is that this crisis is both a breaking point and the continuity of the fights that we had before. And at the moment, we see more the continuity in geopolitical terms than the breaking point.
But Pierre, this is a pre-record because of confinement. We're not able to do it live. So we're speaking before that G20 finance ministers meeting, where they are expected to have a debt freeze for Africa, most notably.
Yes, that's a very positive sign, I must say.
So there is solidarity. There is global solidarity, perhaps.
You're right. On certain level, when it doesn't maybe deal with the fundamental issues of state rivalry, there was a capacity to bring together the Western nations and China and the Gulf countries into giving some oxygen to African countries about the debt. They will not have to refund their debt this year. There is another discussion on whether to cancel the debt in the future. But at least this decision brings $20 billion for the African states to deal with the coronavirus rather than refund the crediting countries. So you're right. At certain level, there is still the capacity to have multilateral agreement on something that is maybe not key to the US or China, but certainly key to a large part of the world.
One final question. I'll put it to you, Dr. Anthony Costello. The $400 million that the U.S. may pull out of the WHO is small compared to the $20 billion you just heard in debt relief that Pierre Aski was talking about. Just remind our viewers here, how much do many countries rely on the World Health Organization?
Well, less than you would think. They certainly like it because they feel they have a voice and because they're member states. They also benefit from it because many of their figures in government can move into local positions in WHO. But you're right.
Forging health policy in many developing countries.
They do listen to the WHO in the sense that they will always look first to guidelines. And in fact, they'll always look first to WHO data rather than data from universities. So there is this seal of approval, if you like, and that's why it's so important to beef up the scientific and the so-called boring normative work that goes behind guidelines, where the WHO bring experts together already around the world and then give very considered guidelines to countries. They like that. But the effects on poorer countries of the economic situation around the world right now will be potentially catastrophic. It's good that both the IMF have put $50 billion into Africa, and if it's true that the G20 are putting another 20 billion, that will help. But in the longer term, I mean, my fear is that people think that this pandemic's over. People are thinking it's like SARS and MERS and that it's all going to go back to normal and there's going to be a big growth, and the markets are behaving bizarrely at the moment because we're just at the beginning of the first wave. And already you're seeing in the Asian states, Korea, China, Hong Kong, Japan, Singapore, flaring up of the epidemic again. A new excellent model that's come out in the UK estimates that we're going to have 49,000 deaths in this particular wave. And at the end of it, only 6.5% of the population will be infected. So we'd have to go through another 8 waves to get to this herd immunity level, with huge death rates. And if we don't get a vaccine, this is going to run and run. We're not going back to normal. And we could have 2 or 3 years. And whether the G20 will be as generous next year to Africa remains to be seen if we're still in a recession or worse.
All right. Well, unfortunately, we have to leave it there. So much more to ask you about. I want to thank you so much for joining us from Yorkshire, Dr. Anthony Costello. I want to thank Jeremy Yude for being with us from Duluth, Minnesota. Pierre Aski in the French capital. Thank you. By the way, you can, if you missed part of our conversation, you can follow us on our YouTube channel, on Facebook, and on France24.com. Thanks for being with us.
Because a new page of history gets written every day. Because breaking news can't wait. Information everywhere. In all situations. On every subject. Understanding the world. Imagining the world. France 24. A different take on the news.
Liberté, égalité, actualité.